Medicare Advantage plans receive a certain amount of funding each year from the federal government, and it can change or vary from year to year. Medicare itself also usually increases the Medicare deductibles and copays each year that you are responsible for paying. This means that your Medicare Advantage plan will usually have to make some adjustments in the benefits that it offers inside your plan for the next year. Hi, I'm Danielle Roberts of Boomer Benefits, here to talk to you about how these changes will be communicated to you via an annual notice of change that your plan will send out to you either by mail or electronically each September. But when I say plan changes, what exactly am I referring to? Stick around to find out. Medicare Advantage plans must cover all of the same medically necessary care that original Medicare Parts A and B cover. However, what they charge for these services can vary from year to year. For example, your plan may notify you that your copay for visiting a specialist is going from $30 to $50 next year. Or perhaps the plan charged a flat copay for a CT scan this year, but next year they'll begin charging 20%. The annual notice of change will list the changing copays side by side so that you can easily compare them. Your plan can also add or remove ancillary benefits from inside your plan. Ancillary benefits are services that the plan has added as extras that are not usually covered by original Medicare. Things like routine dental, vision, and hearing benefits. So if your plan has been covering a routine eye exam for free, and starting next year, it will no longer cover that eye exam, the plan is required to notify you of this in the annual notice of change document. There are several kinds of deductibles that you may encounter inside of a Medicare Advantage plan. Most Medicare Advantage plans do not have a deductible for in-network Part A and B health services, but that's not guaranteed. So if your current plan has no deductible, but the plan is implementing a deductible starting next year, your annual notice of change will detail those changes for you. It's far more common to see a deductible for out-of-network services or for Part D drugs. We often see this one upset people when their plan didn't have a deductible last year, but now in the new year it does, and they never reviewed the annual notice of change sent by their plan in September. Now it's January, and they only find out about the change when they are standing at the pharmacy expecting to pay just a copay for a drug refill, and they get a much bigger bill than they anticipated. You always want to be aware of how much deductible spending you can expect to pay out of your own pocket before you have satisfied that deductible and begin reaping the benefits of your plan. If your Medicare Advantage plan includes a built-in Part D drug plan, then there's a list of covered medications called a formulary that can change from year to year. When you get your annual notice of change packet, look to see if the plan is dropping any medications next year that are really important for you. Will your important drugs still be covered? Likewise, you may find that the plan adds some medications that it didn't cover last year, and this could be a pleasant surprise for you. I should also mention that it is pretty common for plans to shift drugs between tiers from one year to the next. Are your drugs going to be in a different tier with a different cost sharing expected from you? You'll want to know. Drugs in lower tiers will generally cost much less than drugs in higher tiers. So you'll probably want to know if you have a medication that is moving from tier 2 to tier 4 next year. Your plan may also implement new restrictions on certain medications, such as needing a prior authorization from your doctor before they will fill your medication. Reviewing the drug formulary is very important for all of these reasons. Medicare Advantage prescription drug plans contract with certain pharmacies to provide you with options for where to fill your medications. Some of these pharmacies may be what they call preferred pharmacies, where you can get certain medications for better pricing than you can at other pharmacies that are still in the network. Relationships between pharmacy networks and your plan can change, so if you are particular to a certain pharmacy, you'll want to verify if your plan will still include that pharmacy in its network for next year. Just as pharmacy networks can change, so too can provider networks change. Just because your doctors were in the network this year does not mean that they will for sure be in the network next year. Now, provider changes won't be listed in the annual notice of change document though. Each plan has its own online provider directory. So just visit the plans directory each fall to double check that your hospitals and your doctors still show contracted with that plan. All Medicare Advantage plans have a maximum out-of-pocket limit to protect you from spending beyond a certain limit on Medicare Part A and B services each year. Your plan may increase or decrease this limit from year to year. Obviously, the lower the limit, the better it is for you, especially because this limit does not apply to prescription drugs, so your drug expenses will be in addition to whatever you spend on the medical benefits for the year. So it's pretty easy to come out of pocket many thousands of dollars on a Medicare Advantage plan if you have expensive treatment like chemotherapy, radiation, or dialysis. Look to see if your plan is increasing its maximum out-of-pocket limits to see if you're okay with whatever that limit is moving to next year. Can you afford to meet that limit in a worst case scenario? And last but not least, the monthly premium you pay for your plan can go up or down each year. Perhaps the most upsetting premium change is when a plan has previously provided you with its benefits for a zero premium, but the plan decides that next year it will begin charging a monthly premium. For example, maybe your plan has been a zero premium plan for the last 2 years, but starting next year, it will begin charging $20 a month for the plan. This doesn't always mean that you'll want to change your plan, but you'll at least want to take a look at all of the benefits offered by the plan for the next year so that you can decide whether it's worth it to begin paying a premium in January. Medicare Advantage plans are required to send out your notice each year in September. Some of them will literally mail it on September 30th, so don't panic if you don't have it by October 1st. However, if you haven't received it by the following week, you should go ahead and reach out to your plan to see if they can send you another one. You may also want to check your email and even your spam folder inside of your email inbox. Many beneficiaries opt to get their annual notice of change electronically, and it's easy to overlook that electronic notice in your email. In summary, the annual notice of change is an important document to be thoroughly reviewed each fall. Take 30 minutes to look it over each year so that you don't get any unexpected surprises in January that you will find upsetting. If you are fine with the changes, you don't need to do anything at all. The plan will just automatically renew in January unless it has informed you otherwise. But if some of the changes are a concern for you, the annual election period that starts on October 15th is the best time for you to find new coverage that better suits you. Thanks for watching, and we'll see you in the next video.